A common duty as a certified nurse assistant is assessing vital signs. The most common vital signs assessed are temperature, pulse, respiratory rate, blood pressure, and pain. When assessing for temperature, it is commonly taken orally or in the mouth, which involves using a thermometer, placing it under the patient's tongue. It can also be taken axillary, which is under the arm, which is not as accurate, or rectally, which is very accurate in most cases. Pulse is another vital sign, which is measuring the number of heartbeats per minute. It is generally counted by feeling or palpating the radial pulse, and it needs to be counted for a minute. However, if the pulse rate or the heartbeat is regular, meaning it's a steady beat, then it can be checked for 15 seconds or even 30 seconds. And if you count for 15, then multiply by 4 to get the number of heartbeats per minute. If you count for 30 seconds, then you would multiply by 2 to get the number of heartbeats per minute. Respiratory rate is the number of times that the patient breathes in and out for an entire minute. Again, if it's a regular rate, it can be counted for 15 to 30 seconds and multiplied, or it can be counted for an entire minute for the most accuracy. Blood pressure is a measurement of the pressure exerted on the arteries. It is measured in systolic and diastolic. Systolic blood pressure is the top number and is the pressure exerted on the arteries during the contraction of the heart. For normal, healthy, average blood pressure, it would be 120 systolic. The diastolic is the number that is on the bottom. It's the lower number, and it is the amount of pressure that is exerted on the arteries during diastole, or the resting period between contractions of the heart. A common number would be 80. So 120 over 80 would be considered average or normal blood pressure. However, this will vary greatly even among healthy patients, and especially patients that are sick or have some type of disorder. The last vital sign that we want to assess is pain, which is the patient's perception of their pain. First, you ask them if they have pain. If they do, then you want to have their description of the pain and possibly have them rate it, such as on a scale from 0 to 10, with 0 being no pain and 10 being the most severe pain ever. You ask them what number would they rate their pain. And remember that this number is very subjective and that there is no right or wrong answer, and one person's 5 may be another person's 2. So it is just important on a patient to ask them what their rating of their pain is. So as a nurse's aide, when you're asked to take vital signs, these are the things that you will need to assess: the temperature, the pulse or the heart rate, the respiratory rate, the blood pressure, and the patient's pain.